Today we are learning about scapula, also called shoulder blade. Scapula is a flat triangular bone placed on the posterior lateral aspect of the thoracic cage, extending from the level of second rib to the seventh rib. जैसा कि हम यहाँ देख सकते हैं, स्कैपुला बोन जो है वो थोरेसिक केज के पोस्टीरियर लेटरल साइड में प्रेजेंट है एंड एक्सटेंड करती है फ्रॉम सेकंड rib to the seventh rib, and it provides support to the muscle of the forelimb and articulate with the humerus at glenoid cavity and with the clavicle in front. जब हम स्कैपुला का साइट डिटर्मिनेशन करेंगे तब हमें मेनली 3 पॉइंट ध्यान रखने हैं. सबसे पहले हम इसकी सरफेस देख लेते हैं. इट हैज़ अ कोस्टल सरफेस एंड अ डोर्सल सरफेस. द कोस्टल सरफेस इज concave and has a subscapular fossa, while the dorsal surface is convex and divided by the spine into the supraspinous fossa and infraspinous fossa. The scapular bone has two surfaces, three borders, and three angles. Two surfaces are costal surface and dorsal surface. Costal surface is concave and directed medially, having three longitudinal ridges. The spinous process divides dorsal surface into supraspinatus fossa and infraspinatus fossa. These two fossa are connected by the spinoglenoid notch. The spinoglenoid notch is located between the base of the spine and the glenoid process of the scapula. Now, the subscapular bone has three borders: superior, lateral, and the medial. The superior border is the shortest, present near the cricoid process, and the suprascapular notch present on the superior border. Lateral border is thick, having infraglenoid tubercle at its upper part below the glenoid cavity. Medial border is thin, extend from the superior angle to the inferior angle. Now looking at the angles, superior angle covered by the trapezius muscle and inferior angle is covered by the latissimus dorsi. Lateral angle is a broad and bare glenoid cavity. It is directed forward, laterally, and slightly upwards. The scapular bone has three processes: spine process, acromion process, and the cricoid process. Spine process is triangular and has posterior and anterior border. Posterior border of spine has two lips, upper lips and lower lips. The acromion process has a facet for clavicle and articulate with clavicle to form acromioclavicular joint. The cricoid process is directed forward and slightly lateral, having the atavistic type of epiphysis. That's all for this video. In next lecture, we will discuss about the attachment of muscles on scapula. Thank you.